Hi, this is Carrie Gerling, and this is my second persuasive speech for Communications 101. This is my audience. I chose my topic to be on unmet healthcare needs of the homeless population. Mostly that has to do with insurance. I'll be using Monroe's Motivate sequence for my speech that has attention, shows a need, shows how to satisfy that need, and visualize the solution and how to help out. There's a crisis today in healthcare in which poor, uninsured, homeless individuals are victimized as a result of their lack of resources. According to an article by Smith, the homeless population is caught between multiple unresponsive systems. For example, many low-income families have limited education and are unemployed. And as you know, if you don't have a job, typically in America you don't have health insurance. So when you don't have health insurance, you won't have access to health care services. Various issues are pertinent to the availability and the depth of community-based healthcare services. For this speech, I will discuss the healthcare problems, statistics, and typical medical histories of the homeless population. I will also discuss the area of underinsured and touch on the idea of solutions. When you think of the term homeless individual, homeless person, the federal definition is an individual who lacks a fixed, regular, or adequate place to sleep at night, or a person who has to stay at a public or privately owned facility that's housed up to where people will stay, including welfare hotels such as the Missouri Hotel in Springfield on Commercial Street, or transitional housing, which is typically for the mentally ill. It also is a person that stays in an institution that provides a temporary residence for individuals, or a place that's publicly or privately not designed for or ordinarily used as a regular place for human beings to sleep. The statistics surrounding the homeless population in Missouri is that there is an estimated 45,000 people who are homeless. 20 to 25% of these people are mentally ill, and it's estimated that 40% of these people have substance abuse or alcohol problems. And that's from Bill's Place, which is another homeless facility on Commercial Street. When you think about a homeless individual and healthcare needs, there are many illnesses that typically are only found in compromised populations, such as tuberculosis, AIDS, malnutrition, severe dental problems. These devastate the homeless population. There are other health problems that surround any income levels, which include alcoholism, mental illnesses, diabetes, hypertension, and physical disabilities. These are very prominent on the streets. People who are homeless are more at risk for natural or man-made problems. They fall prey to parasites, infections, and violence, including trauma. Each year, millions of people in the United States experience homelessness and are in desperate need of these health care services. And with them not having medical insurance, they don't have the cash to pay for this. And this comes from the National Coalition for the Homeless. When you think about also the homeless people are not just in the urban centers, they're kind of dispersed throughout rural America, frequently not near the health care facilities that they need. They don't have transportation or control over their daily life. They are kind of base their day on the routines of the shelter, the soup kitchen, and marginal jobs to meet their both basic survival needs. Finding health care is tough or impossible, and many times they wait too long to seek care. And that is when you see them in the ER, when it's gotten to the point where they are almost unable to fix, and increases acute care stays and emergency visits, which cost the community a lot, and also leads problems to the community in regards to exposure to these illnesses for ourselves. When you think about the lack of insurance, that is a large barrier. The ER has seen an increase in the amount of uninsured people and uninsured homeless people with untreated medical issues. Ultimately, as I said, they come in whenever the situation worsens. So now that we've talked about barriers, and let's talk about some solutions. Some solutions based off health care for the homeless project are most successful because they are designed and controlled by local communities to fill significant gaps in healthcare delivery systems. The federal Medicaid program has been a program that's been in place for homeless women, children, and some men with some disabilities. But with the changes in Medicaid, this is also causing a lot of loss of health care coverage for people who don't have homes because they don't have an address. You want to use multidisciplinary teams working together to remedy the various problems that the clients face. Going beyond traditional medical care, these effective teams work with the clients to address the issues of safe shelter, permanent housing, jobs, income, family relationships, and substance abuse. You want to use a comprehensive approach that helps people get well and move out of their homelessness situation. Another area I want to touch on is universal health care. Everybody agrees that health care should be accessible to all, but debate still rages on whether a universal system would be wise or even a realistic solution. Some would say several problems come to mind from a capitalist health care. Drug companies, hospitals, the industry as a whole makes decisions based on profits it will provide them, and not the health care it will provide to the patient. If you have money and you need a liver transplant, you have universal health care, yes, but if you've got the money, you've got the cash, you're still going to get the transplant first. So that could be an issue. Medicine is much cheaper in countries with socialized health care, and that's a fact. Now, the question to resolve would be why other people do not deserve for you to contribute towards their care. The act of democracy grants each citizen a rightful place in society, yet capitalism obliterates that place after the vote. So let's try to visualize what we could do as a community to help with the situation. It's not a clear-cut solution for this problem, but ideas of universal insurance are kind of tossed around in the air. But taking care of the less fortunate is an investment in itself that you cannot afford to miss. Thank you. Done. I was like, I can't do it.